top if that's not already thanked. But
He's got a motion. Send it back. Quick second without objection. I'll send it back.
I'd like to call the Finance, Ways and Means Committee to order for March 16th, 2021. Mr. Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gant, Garrett, Gillespie, Hawk, Hicks, Lamar, Lamberth, Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chairman Hazelwood. Madam
Here.
Chairman, you have a quorum.
Thank you, Mr. Clerk. Are there any personal orders or announcements? Seeing none, we'll go directly into our calendar, which will be followed by a budget presentation from Health. But we do have 9 bills on our calendar today. The first item on the calendar is House Bill 94. I believe that's being presented by Representative Boyd. We have a motion and a second.
Thank you, Madam Chairman of Committee. House Bill 94 is an administration bill. It makes 4 different changes to existing workers' comp law. The first is that any sort of post-settlement or post-judgment hearing, the employee bears the burden of proof and the preponderance of evidence is on the injured worker. Section 2 and 3 deal with the Next Step program, which is a vocational assistance program, and it allows injured workers to re-enter the workforce and be retrained to a different job. It streamlines that a little bit, makes it a little bit quicker for them to hit the workforce. And Section 4 simply allows workers' comp judges to use judicial mediation in addition to the traditional mediation that the Department of Labor currently has. Madam Chairman, I'll take any questions.
You've heard the sponsor's explanation. Are there questions? Seeing none, we have a question called on the bill. All those in favor of House Bill 94, please signify by saying aye. Aye. Any opposed? Ayes have it. House Bill 94 moves on to calendar and rules.
Thank you, Madam Chairman.
Thank you, Chairman Boyd. Next up is House Bill 107 by Chairman Halsey. We have a motion and a second. Chairman, you're recognized.
Thank you, Madam Chairman, and thank you, committee. We passed this bill last year, but the language in it was a little convoluted and it was causing problems with clerks across the state, county clerks. So we brought the bill back and reworded it so the clarity would be there. And in that process, they found out that the two letters Bravo Tango, which is on this amendment, is already in use. So they came out with another one, Bravo Delta, before the 4 or 5 numbers on the tag.
You've heard the sponsor's explanation. Are there questions? Leader Camper.
Thank you, Madam Chair. Mr. Sponsor, this is the bill dealing with the boats, allowing them to get tags so that they can transport through the various states without having to pay a fee or be fined or something like that.
Chairman Halsey.
That's exactly correct. We have 5 boat manufacturers in the state of Tennessee. You don't have to have a tag on a boat trailer here, but they hire people to transport them all over the country to deliver them. As soon as they leave the state, they start getting tickets. So yes, this is a tag to stop that.
And there was a problem with the lettering for the tags, and we're fixing that problem with this bill.
Chairman Halsey.
Yes, ma'am, that is correct. They found out that the Bravo Tango was already on a different tag, another tag. So they came out with the BD, Bravo Delta, to fix that.
Thank you. Thank you, Madam Chair.
Further questions? Seeing none, we'll be voting on House Bill 107. All those in favor, please signify by saying aye. Aye. Any opposed? House Bill 107 moves on to calendar and rules. Thank you, Chairman Halsey. Next on our agenda is House Bill 92. Speaker Pro Tem Marsh, you're recognized. We have a motion and a second. Sponsor, would you like to give us an explanation of the bill, please?
Thank you, Madam Chairman. HB 92 is brought to me by TDOT. It's an administration bill. Tennessee law currently requires TDOT to notify utilities by certified mail before starting a project, so utilities can provide where their facilities are located within the project limits. This bill would allow TDOT to send notices by email. This bill will speed up the process, reduce postage, and save TDOT over $60,000 a year. With that, I'll answer any questions.
Are there questions of the sponsor? Question has been called. All those in favor, please signify by saying aye. Aye. Any opposed? Ayes have it. House Bill 92 moves on to calendar and rules.
Thank you very much.
Thank you, Mr. Speaker Pro Tem. Item 4 on our calendar is House Bill 62 by Representative Carringer. Representative Carringer, you have a motion and a second. You are recognized.
I know. Thank you, Ms. Chairman, and to your exceptional board. It's an honor to be here with you all today, and it's my first time. So I'm bringing to you House Bill 62, and what this bill does is it deletes the Advance Notice Registry, Contact Veto Registry, and revises provisions related to the sealing of adoption records. The Advance Notice Registry allows an individual 15 days notice before an adoption record is released to their biological child. This Advance Notice Registry has been underutilized with only 32 individuals and no recorded hits on the registry. Eliminating this process will save the department time and resources. The Contact Veto Registry allows a biological parent to identify if they want to contact with the child. And so with that, I will leave you all to see if you have any questions.
Okay, we have Representative Freeman. You're recognized.
Thank you for this bill. I do have a quick question, and I just want to make sure that I understand. This is not doing away with us keeping a record of the addresses and contact information from these folks. It's literally the contact veto that if they don't want to be reached, that we get rid of.
Absolutely, it is not doing away with that. It's simply they're already doing that, and this is also doing that, but this way is not, people are not using it, so it's kind of just cleaning it up and to cut out an extra step that the employees are doing.
Thank you. Thank you.
Leader Lamberth.
One, thank you for carrying this bill for the administration. You started off on the wrong foot there in two regards, really, by saying it was your first bill. You probably should never admit that. But
I know, I noticed that after.
And then
Ma'am, she has not been recognized.
yeah, you really have to go through Chairman Hazelwood, and we were all kind of wondering which board we were talking about here. So I know you come from a certain other elected body, but seriously, I was going to give you grief over this bill because it's your first bill. But it is a really good piece of legislation. I appreciate you carrying it, and we will reserve any amount of grief for the floor or possibly Chairman Zachary's committee. And are you really seeking to be recognized after that comment?
Representative Carringer.
Yes, I am. You know what, people? This is the treatment you get for trying to help out your fellow colleagues.
Oh, it's going to get...
We have a question on the bill, and I would just, as an aside, Representative Carringer, you may have opened yourself up for tough time ahead, but we will let you deal with that at the appropriate time. Question has been called. We are voting on House Bill 62. All in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 62.
Thank you
moves to
so
calendar and
much.
rules. Item number 5 on our calendar is House Bill 99 by Representative Jernigan. We have a motion and a second. Representative Jernigan, sorry, you're recognized.
Thank you, Madam Chair. I appreciate that. Members, last year we passed the Dynamic Accessibility Act, and it kind of cleans this up that we avoided a fiscal note last year saying that we can update the signs based on whether or not they were damaged or there were renovation going on. Had a couple of agencies last year that wanted to update on their own resources, but the law wouldn't allow it. So what this does is if the department wants to do it within their existing resources, that they can make those updates, and that kind of is what the bill does. So any questions, I'll be happy to answer.
Members, you've heard the explanation from the sponsor. Are there questions? Question has been called. We're voting on House Bill 99 by Representative Jernigan. All in favor, please signify by saying aye. Any opposed? Seeing none, ayes have it. Representative Jernigan, your bill moves on to calendar and rules.
Thank you, Madam Chair, members.
Item 6 on our agenda is House Bill 93 by Representative Garrett. We have a motion and a second. Representative Garrett, at your seat.
Thank you, Madam Chairman. This is an administration bill from the Division of TennCare, and what it does is right now, if someone is receiving TennCare services and they pass away, TennCare has a lien by operation of law against that estate that's eventually opened up. And right now, there's absolutely no statute of limitations on that lien. This bill, which I congratulate the division for pointing out, requires a 4-year statute of limitations on recoveries against an estate by the Division of TennCare. The fiscal note is funded in the governor's budget, so if there's any questions, I'll be happy to take those.
And we do have a couple of questions. Representative Shaw.
Thank you, Madam Chair. Ms. Sponsor, I've been looking at this. I'm really trying to get this. Then when I looked where it decreases state and federal funds, I wonder why we're giving up all that for this time period. Does that give, in your opinion, TennCare more time or less time? If that's a fair question.
Representative Garrett.
In a lot of sense, the ways when activities in the collection world, I do practice law and I do some collection work. After a certain period of time, you simply have to write off some of those bills, some of that monies that might be out there. So they're spending a lot of resources on claims that could be 6, 8, 10, 12 years old that are pretty much going to be uncollectible anyway. So what we're hoping to do is that TennCare can concentrate on these claims that are much younger, that are hopefully will be more collectible. Therefore, we may collect even more money than we're anticipating. But these claims get so old they're almost not even worth sticking around, but they do clog up someone's real property for the lien purposes that's out there by operation of law. So it kind of clears up any title issues we might have some folks if that 4-year passes. So this is a very good piece of legislation that I'm going to be frank that I'm not worried about losing any more money on this, because this is going to be a good thing to concentrate on those cases that are much younger that might be actually collectible.
Representative Shaw.
Just briefly, do you think this is going to help the citizens? Think it will help citizens?
Representative Garrett.
I absolutely do, because I've had a couple of cases in my law practice where the actual real property is tied up for title insurance purposes, because there's that actual lien on it that is uncollectible. We got to get a release of that lien. So I absolutely do think this is going to help the citizen. Thank you for that question.
Leader Lamberth.
Thank you, Madam Chairman. And Representative Garrett, thank you for carrying this. It happens to be an administration bill, and Representative Gatt and I, Leader Gatt and I both appreciate you carrying it. But I will tell you, this actually predates to Representative Shaw's question. I had a lawyer in my district call me. He's a very good friend of mine. We've known each other since childhood, who had this exact issue. And it was years after he had handled an estate for a family that they get a notice seeking to recover from the estate. The assets had been distributed to family members. I mean, it was a horrible situation. And it was years. So if you can imagine, your loved one passes away, you think you've handled any, debtors, you think you've, closed everything out, and then all of a sudden the state of Tennessee sends you a notice. I really commend really the governor's office and the state in saying, look, we're going to put ourselves on a time limit, and it's going to be 4 years. If they've not filed within 4 years, and quite frankly, I hope down the road it becomes even shorter time period than that. I mean, there's no reason to wait longer than that to recover assets. So again, thank you for carrying the legislation, regardless of where it came from. But I'm glad everybody's working toward helping out folks that have lost a loved one here.
Representative Miller.
Thank you, Madam Chair Lady. Sponsor, give me an example of a claim by TennCare against a TennCare recipient.
Okay. Madam Chair, and I'll answer that question, but I did have an amendment that I don't believe I took care of. I've got amendment code 3901.
That amendment is traveling.
It's traveling. I want to make sure. I thought it was traveling since it kind of put on sub, but I wanted to make sure I didn't need to move. So thank you for that clarification. You needed an example. Here's one that you've got someone that receives TennCare service. They're in an assisted living facility and they qualify for TennCare, and they're receiving those TennCare services. So TennCare is actually paid out on their behalf. If they have an estate that they have to open up, either to transfer property or to get property out of that person's name to the eventual beneficiaries, TennCare basically has a lien by operation of law on the assets of that estate. So for whatever reasons might take place in the administration of the estate, if they don't ever transfer the property, the executor doesn't sign the property over, deed the property over, this lien is out there potentially for years and years, and it's unlimited. So if they ever want to go back and transfer or figure out what the title is to this property and 10 years have gone by, this lien still exists. So they still have to deal with TennCare and paying TennCare back. What TennCare is saying is that we're going to shorten that time frame that the lien actually exists. So they can't go back and recover from estates more than 4 years. I hope that clears up that question, but thank you for the question.
Yes, thank you. Thank you, Madam Chair Lady.
Are there further questions? Seeing none, we're voting on House Bill 93. All in favor, please signify by saying aye.
Aye.
Any opposed? House Bill 93 moves on to calendar and rules.
Thank you, Madam Chair and committee.
The next item on our agenda, item number 7, is rolled 1 week. Moving on to item number 8, House Bill 38 by Chairman Todd. Motion. We have a motion and a second. Chairman Todd, you're recognized.
Thank you, Madam Chair. Present law provides that if the Commissioner of Revenue changes the Department of Revenue's policy as to the taxability of any privilege, such policy change must be applied to the exercise of such privileges occurring after the date of that policy change unless otherwise provided by law. This bill adds that a taxpayer may actually rely on guidance published by the Commissioner of Revenue concerning the taxability of a privilege. The bill further specifies if the Commissioner changes the guidance, taxpayer who relied on the prior guidance is not liable for any additional tax, penalty, or interest accrued before that guidance was changed. and was unpaid because of the taxpayer's reasonable reliance on the prior guidance. It also specifies if a taxpayer is audited or requests specific advice from the department and receives erroneous audit findings or advice, and the taxpayer is not liable for any assessment of additional tax, interest, or penalty. The NFIB has worked with, and small business owners have worked with the department to get some clarification and get this codified so that taxpayers can rely on the information that the department puts out in either guidance or they have in audits, decisions that are made in audits. We've cleaned up a few things like that in the last couple of years where there's been some misunderstandings and maybe audits that had findings in one part of the state but not in another on the same item. So this just further protects taxpayers so that they can rely on the information that the department is providing, and it memorializes certain things so that taxpayers have a good feel for what they can rely on in the future.
You've heard the sponsor's explanation. Are there questions? Seeing no questions for the sponsor, we'll be voting on House Bill 38. All in favor, please signify by saying aye. Aye. Any opposed? Ayes have it. House Bill 38 moves on to calendar and rules.
Okay, members, we're now on item number 9, House Bill 85 by Chair Lady Hazelwood. We have a motion and a second. Chair Lady Hazelwood, you're recognized, but I believe we've got an amendment. It's Amendment 4524. Okay, motion and second on the amendment. Chair Lady Hazelwood, you are recognized on the amendment.
Thank you, Mr. Chairman. And the amendment does make the bill, and it just says that the effective date of the streamlined sales tax agreement, we've been kicking this can down the road every 2 years for quite some time. And the most recent extension was 2 years ago. We're deleting these streamlined sales tax agreement provisions permanently and removing that fiscal impact originally estimated for the agreement. So this really just takes us out. We're still an associate member of that organization, but rather than just renewing this every 2 years and staying an associate member, we're just saying this is how streamlined sales tax is going to work in Tennessee. With that, Mr. Chairman, I stand ready for questions.
Any discussion on the amendment? Questions have been called. We're voting on the amendment. All in favor say aye. Opposed, no. Amendment is added to the bill. And now, Chair Lady Hazelwood, would you like to make any additional comments about the bill?
As I mentioned, the amendment makes the bill. So.
Questions been called. Any further discussion? If not, we're voting on the bill as amended to send it all onto calendar and rules. All in favor say aye. Opposed, nay. Okay. House Bill 85 moves to calendar and rules.
That does complete our calendar for today. I would ask that our folks from Health who are going to be presenting their budget today, Dr. Piercy and whomever she has with her, if you would come down front. I probably need to move over. Hey, John, just be. Dr. Piercy, welcome. We're glad to have you with our committee today. I know that you have a lot to tell us, and I will just start out up front by saying thank you again to your department and to all the health departments across the state who have just risen in an amazing way to a challenge that sitting here a year ago today, we would never have anticipated how long and how deep and how tough the road would be in front of us. But you guys have, knock on wood, brought us through, I hope, to the other side. I know I'm excited. My number of my family members have gotten their first and some even second vaccinations, and I've had mine. It makes me feel much better. So I just want to start out with a thank you and then ask you if you would just go straight into your budget presentation for us today. Thank you.
Thank you, Madam Chair Lady. Appreciate those kind words. It's the people to my right and left and all the ones out there in the field that are doing the heavy lifting. Speaking of those to my right and left, on the far side is Dr. Tim Jones, our Chief Medical Officer, Ms. Valerie Oliver, who is our Assistant Commissioner of Operations. Then we've got to my right is Dr. Morgan McDonald, our Deputy Commissioner of Population Health. So I wanted to start with an overview of COVID, which will never be able to be contained on one slide, but I did want to highlight a few things for you. Just since we made this slide a few days ago, we are now almost up to 2 million vaccinations. That's 2 million doses. That is 1.265 million Tennesseans, so 1,265,000, which is about 17% of our population. We've done almost 7 million tests in the last year. And then another thing that we're particularly proud of is our hospital staffing assistance grants that was administered by Dr. McDonald and her team. It really helped hospitals, support hospitals with their staffing and other needs during the pandemic. And then something else that I wanted to highlight off of this was our work in long-term care facilities. Many of you know we've had a strong focus on long-term care facilities and specifically the elderly during the pandemic. And when we developed COVID-specific nursing homes, that helped two things. One, it helped those patients have an appropriate place to go and get good care, but it also helped offload our hospitals, which was a huge win. We are very fortunate that our death rate in long-term care facilities in Tennessee is about 30% lower than the national average. So without a doubt, the work in these facilities have saved lives that had those residents been in another state, they may not have survived.
Dr. Piercy, if I could interrupt you, my oversight, we did not formally go out of session. I was so excited about thanking you and bragging on the great job that you all had done that I forgot to do that. So we are officially out of session. Thank you.
Should I
And
start
please-
over?
No, please resume.
Thank you.
We'll replay it on the video.
Okay, good. So keeping going, a lot of us just think about the pandemic. And, when you think about the Department of Health, you think, well, everything else must have just stopped. Well, clearly things had to slow down and change a little bit, but the work didn't stop and the progress didn't stop. We, just like all healthcare providers, have had to shift and change and adapt. We were able to consider or continue our WIC program virtually. That removed a lot of barriers for people for coming instead of coming in an in-person visit. We also did a lot of innovation through telehealth, as did many other providers. And we still had some big wins. We continued to see our NAS, or neonatal abstinence syndrome rates, go down, as well as our sleep-related infant deaths. NAS is down 27% over the last 4 years, and sleep-related deaths down 26% over the last 4 years. So getting into the budget, you'll remember that our funding is split about a third with state, federal, and other funding. And it is primarily comprised of the large categories you see here. In the upper right, local health services, that's what's delivered at the local health departments. Some of those are self-explanatory. WIC is a big portion of that. And then other health services are things that you might not as readily think about. Our public health lab, our communicable disease and emergency preparedness, family health and wellness, and several other programs there. I also wanted to remind you, and this is just as much of a reminder for us, this is the 4-year strategic plan, or this is a visual representation of the 4-year strategic plan that we did a little over a year and a half ago. Even throughout the pandemic, these were still our areas of focus. This was still our mission to protect, promote, and improve the health and prosperity of people in Tennessee. And I could probably talk for an hour about why it is written just like that. But I hope you have seen us live that mission throughout the pandemic. And then you'll also notice our two areas of focus are prevention and access. I want you to remember those because that's going to come into play when we talk about our request for this year. But even throughout the pandemic, again, focused on those priorities. So we have four cost increases to propose to you this year. These key initiatives total about $4.3 million, and they align with our mission and strategic priorities, and they include no personnel increases. The first one is a $2 million expansion of the healthcare safety net. We were grateful that last year the Governor and General Assembly made the largest investment in safety net history to the program, and we are requesting an additional $2 million recurring for that to take the base funding from 19.9 to 21.9 million. This is primarily the way that uninsured Tennesseans are served when they don't have Medicaid and they don't have any other types of insurance. This is the primary mechanism by which uninsured Tennesseans get care. We do expect that number to grow, resultant from the pandemic and the economic downturn with some employers, as well as higher unemployment. We do expect this number to increase, so we are respectfully requesting an additional $2 million for the safety net. The next large one is a recurring $2 million for tobacco prevention programs. You know, I think smoking is so ubiquitous that people forget about how dangerous it is and how deadly it is, particularly in our state. We're 43rd in the nation in smoking, and that's not 43rd. That's not good. It's 50 is the worst. We continue to see youth initiation. We continue to see tobacco-related deaths. And speaking of tobacco-related deaths, I'm sure you can all quote the statistic about 10 Tennesseans die per day from opioids. About 30 Tennesseans die per day from tobacco-related disease. So even though it's very common and we get used to it, it's still very costly and very deadly. We are one of only 3 states that does not have any recurrent funding for tobacco prevention or cessation, and we are respectfully requesting that you change that. This is just an example of some of the youth-led marketing that we particularly targeting vaping, and this is part of the work that's funded with these funds. The other 2 items, one is a retinal scanner. Retina, don't mean to insult anybody's intelligence, that's basically the back of the eye, and it can be severely affected in diabetics. So when people with diabetes have uncontrolled blood sugar for a long time, it can cause retinal damage. That's called diabetic retinopathy. Because we are such a large primary care provider throughout the state, we have over 9,000 patients on our patient panel that have diabetes and need proper retinal screening. The current technology that we have is out of date, and this is a very cost-friendly solution that we can put in our health departments. It's a one-time non-recurring of around $82,000, and then the ongoing licensing and software is another $12,000. So that's a total of just shy of $94,000 for the retinal scanner. And then the final request is for an integrated data system for $250,000. This is an upgrade to the system that we currently use to do all of our data analysis for opioids. That department is, or that division is housed in our department. And so now we're bringing on more substances, particularly methamphetamine and stimulant abuse, seeing a lot more of that. We need to expand our software systems in order to keep up with that. And then on our efficiency plan, we are bringing to you $8 million in reductions. Those are all for revenue offsets and operational efficiencies. There is no personnel decrease and no decrease to frontline services with this efficiency plan. And then finally, as per the requirement in the fiscal 21 appropriations bill, we have submitted to you 100 vacant positions for elimination, returning $5.7 million total and $2.8 million to the general fund. That concludes my presentation, Chairwoman. I'm happy to take questions.
Thank you, Dr. Piercy, for being, moving through that quickly and giving us time. We do have a number of questions, and just a small one that I'll ask before we get started on those that will be, I'm sure, much more in depth. But you mentioned on the retinal scanner, is that for one scanner, and how is that going to serve 9,000 patients across the state? Help me understand that a little bit.
No, ma'am, it's actually, it's a small unit for every health department.
Okay, so per unit cost is relatively small on
That's right.
those?
It's a pretty reasonably priced piece of equipment.
Okay, thank you. Chairman Hicks.
Thank you, Chair Lady and Commissioner. It's certainly good to see you and your staff here, and it's good to hear about all the good work that you all have done. And I know I have called you a couple times, and you've always been very cordial, and I really appreciate that. And your office is also very responsive. Talking about the healthcare safety net, the proposed budget includes $2 million in new recurring funding for the health care safety net. What has the pandemic, or how has the pandemic affected utilization of the safety net for this year?
Dr. McDonald administers our safety net program, so I'll ask her to take that one.
And if you would just your name and title for the record, please.
Okay. Hi, I'm Dr. Morgan McDonald. I'm Deputy Commissioner for Population Health. Appreciate the question. We've certainly seen quite a strain on safety net services largely across the state. We have actually put a number of measures in place to increase flexibility. So the availability of this funding is now available for telehealth in addition to general in-clinic visits. And then with the appropriation from last year, we were able to issue an RFP and expand our clinic footprint to be able to fund 5 additional primary care sites and 12 dental sites. And then also have put into place some expanded access to specialist care, particularly in rural regions and in the western part of the state. And so, safety net clinics, just like non-safety net clinics, have actually seen a decline in volume, just fear of going in for services. And so they've really been trying to think of creative ways to make sure that people are coming in for particularly chronic conditions that could go unchecked, as well as acute care visits.
You mentioned last year, last year's budget included $9.5 million in additional non-recurring funding that is only partially replaced with this proposed cost increase. Will the decrease in funding affect availability of safety net services?
Sure. So you're correct in that that's $2 million, converting part of that non-recurring budget to recurring by $2 million. And so we have a couple of quality incentive programs and other capacity building uses for the non-recurring piece of that funding. We do not anticipate that services will decline or the number served will decline over the next year based off of that recurring, non-recurring distribution.
All right. Thank you very much. Thank you, Chair Lady.
Next on the list, Leader Lamberth.
Thank you, Madam Chairman. Commissioner, thank you for, again, all of your hard work and your team's hard work over the last year. When, as the chairman said, there's no way you could have known that you signed on for this, but I'm confident that the good Lord had you in mind for this position when the governor chose you. You've done a fantastic job, and I appreciate your friendship and all of the work you've done. And quite frankly, all the phone calls you took early in the pandemic when we had a nursing home that got hit, one of the first and one of the worst. And with your leadership, you helped us do that. So we appreciate that. I have a question really dealing with, there's about $63 million that were reverted back. And was that due to federal funding that came in that allowed for that reversion? And then on top of that, where exactly did that go? What are the plans for that going forward? I think it was about $63 million that was reverted back. Just want to get a little details on that if we can.
Sure. Thank you, sir. Thank you for your kind comments, and thank you for all your support throughout the pandemic. I'll ask Valerie Oliver to take that one.
Can you hear me? Okay. Yes, because we received additional federal funds, we were able to turn that back into the state.
Leader?
And when you say back into the state, did it go back into the general fund? Did it remain in the department's budget or?
It goes back to the general fund.
Just want to make sure. Thank you.
Chairman Crawford.
Thank you, Madam Chair Lady. I have a couple of questions about the vaccine and testing. I'm from the Bristol area, so we got the track and we're doing lots of them. My first question would be, is there a possibility or that the state we can get more vaccines, or is that all federally regulated on what we get?
That's a good question, sir. Thank you. We max out the order every week. So that is completely controlled by the federal allocation. The supply has slowed down a little bit more than what we initially anticipated. I did participate in a White House briefing this morning that said we are supposed to get a small bump the week of the 29th and then a bigger bump the first week in April. Otherwise, we're just at the mercy of whatever they send us.
Okay.
Chairman Crawford.
Thank you, Madam Chair Lady. How much are we spending currently on the vaccines and the testing per week, per month, or whatever data you have?
So the vaccine and all of the supplies needed to go with it are provided at no cost by the federal government. The testing, we would have to get you the PCR number, but the feds also provide the Binax Now rapid test. We've received over 2 million of those, and so those are also at no cost. It's just whatever the health department is doing from a PCR standpoint. And Valerie, do you know that number off the top of your head, or shall we follow up? Okay. We'll follow up with you on that.
Chairman Crawford.
Thank you, and I'm sure that would be interesting for the other committee members, so if you could just get that to the chair lady, she'll distribute it out.
Yes, sir.
Do we have sufficient resources available to meet the needs that we're going through right now in the state?
Can you narrow that question a little bit?
Well, I guess what I'm asking is, are we getting enough to cover the people that are eligible at this particular time?
For vaccine supply?
Yes.
No, sir.
Okay.
Let me add a but. But that will change soon, because there will be a time in the very near future, maybe in the next 2 to 4 weeks, where supply will exceed demand. And demand is going to drop off because the people who want the vaccine are already generally in the process, not everybody, but a lot, as well as we're seeing really low uptake rates in our rural areas. In rural West Tennessee, I have 90% of all available appointments open. You can get a same-day appointment pretty much anywhere in rural West Tennessee. East Tennessee has about a 50% fill rate. Middle Tennessee has about an 80% fill rate. Those are the rural health departments. Metros are a little bit different, but we're seeing pretty low uptake, particularly amongst rural areas, communities of color, and low-income workers.
Chairman Crawford.
Thank you for your indulgence, Mrs. Chair Lady. My final question would be, how do you feel like we're doing as a state as far as making things available for just those areas you're talking about, those rural, hard to get to places?
So we have vaccine in over 700 locations, and we have another 500 locations that what we call are onboarded. They're ready to receive. They've had the training, they've had the certification. They just don't have enough product to go around yet. So I think people get in the habit of thinking it's just at the health departments. That's actually only a very small percentage of the places it's available.
Thank you.
Thank you, sir.
And just to follow up on one of the questions that Chairman Crawford asked, it's concerning the take rate in these rural areas where we've seen a really high, COVID infection rate. So what plans does the department have? How are we going to, assume that's education, that's marketing, that's all of the above, but how are we going to try to improve those take rates as we get more vaccine?
Yes, ma'am. Vaccine hesitancy is something that the department has been dealing with for years, well before COVID vaccine. And so we know that education and providing that education through trusted voices in the community is the best mechanism, as opposed to, I'm here from the government and you should trust me. That doesn't work. And so we're engaging with those trusted voices in the community. But I will tell you what the most effective thing is when somebody gets theirs and then they tell a family or friend. Because even with those trusted voices, sometimes it's hard to see how am I like you, or what makes me similar. But when a family or friend gets it, then the person in their tribe is more likely to get it as well. I will also add that the hesitancy is not unique to Tennessee. It is pretty widespread amongst the South. I do a call with my Southern counterparts every Monday morning, and that was the primary topic this past week about what low uptake rates that they're all seeing.
Representative Gillespie.
Thank you, Madam Chair. Dr. Persley, thank you so much for being here. Before I get to my question, I just want to state thank you so much for everything you've done. As we've talked before, I work in a long-term care facility, and y'all have just done an amazing job with that population. So thank you.
Thank you.
Moving to a different direction here. This year in the budget, there is a proposed $2 million recurring fund for tobacco prevention. In years past, it's been anywhere between 5 to 4, and anywhere in that range. Can you kind of go in, you touched on a little bit of it, but can you go into what kind of specific programs that extra $2 million would get that we're not doing now?
Sure. Thank you for the question. Dr. McDonald?
Thank you. Also appreciate the question. So you're correct. We have had some non-recurring funding that has come to the department from the general fund directed to the state. There was a $15 million settlement allocation that was between, I think it was fiscal years 14 to 16, and then there was a non-recurring $5 million later. It was funded in the budget last year and then was removed with the amendment given COVID and the uncertainties that we had going forward this year. And so we've not had recurring funding in the budget for tobacco prevention. That being said, we've really made quite good use of the funding that we have received over the years. And that's included over the last 5 years, actually a 38% reduction in youth smoking, and then a 20% reduction in smoking during pregnancy. And so those are two key indicators, obviously, of long-term health outcomes. We would propose to spend this funding in a similar way, really community engagement, particularly in youth prevention and prevention around vaping, whereas we've seen significant declines in combustible tobacco use in youth. We've seen significant increases in vaping. Almost 25% of youth, high schoolers vape within the last 30 days. And so that's concerning, certainly for a number of reasons. So those two programs, certainly we would target that with local grants as well as with some statewide initiatives around both prevention and cessation.
Yes, thank you, Madam Chair. Thank you so much for that explanation. I guess my point that I'm kind of getting to, back to COVID, am I right in thinking that as people are working from home, they're stressed, there's no restrictions in their homes like there are in office buildings for smoking, that maybe there's an uptick of smoking and vaping?
There's been a national trend, particularly calls to the quit line, for example, have declined nationally. And so we're tracking that certainly as a state as well. So we're concerned about that as well.
List Chairman Hawk.
Thank you, Madam Chairman, Commissioner, your team. Thank you very much. Not often do we hear the word ubiquitous in committee when talking about smoking. So not to my direct left, but to my far left, I had to explain what that word meant. So
My apologies.
No. Thank
Representative
you very
Faison.
much. It's a learning experience for all of us. Thank you. If I could, I want to follow up on a question, Madam Chair, that Chairman Crawford asked about testing, and then go to another question as well, if it's okay. As you're talking about testing, 2 million available tests, are we testing for COVID-19, COVID-20, COVID-21? Are we testing for a coronavirus, or what are we specifically testing for at this point in the pandemic, ma'am?
Sure, that's a great question. So there's basically two kinds of tests. One of them is the traditional PCR test, the one that they used to call the brain tickler. It doesn't have to go up so high anymore. But that is a traditional viral test where they actually look for parts of the virus, but it is specific to SARS-CoV-2, which is COVID-19. The 2 million tests that were provided to us by the federal government are the Abbott Binax Now. They're the rapid tests for the 15-minute where you just put the front of your nose and then you do it right there on the card. Those are testing for an antigen, which have a high specificity but a lower sensitivity. So, which means when it's positive, you can pretty much bet it's positive. But if it's negative, it doesn't necessarily mean it's negative. That's the difference between sensitivity and specificity. So you have a trade-off of speed and convenience, 15 minutes versus sending it off to a lab for a day or two. You have speed and convenience, it doesn't pick up as many, but they're good for screening, or what we call surveillance, of testing large populations to see who has it. Also very quick turnaround. Schools have used a lot of them, nursing homes have used a lot of them, and then a lot of industries have requested those from us as well.
Chairman Hawk.
Thank you, Madam Chair. Switching gears as well, can we talk about the Traumatic Brain Injury Fund? And please, could you discuss the funding source and the sustainability? I'm noticing that fund is decreasing. If you could please talk about the Traumatic Brain Injury Fund reserve.
Sure, Dr. McDonald.
So you're correct. The source of that funding has been traffic fines. And obviously, as people are driving less, there's been less revenue that has come in for the program. That program does support a number of initiatives, one being the Brain Injury Association, and then a number of really community dwelling for individuals with traumatic brain injury, and care coordination for services for survivors. It also supports the TBI registry that provides data around TBI in the state.
Chairman Whitson.
There you go. Thank you, Madam Chair. Dr. Piercy, I just want to, again, as many of my members have said, just want to thank you and your team for what y'all have done during these extraordinary times. And in the Army, we always hold the commander responsible for everything. But I just want to tell you, your leadership and expertise has been extraordinary. And the people of Tennessee owe you and your team a lot for getting us through this. And I know we're not at the end, but we're getting close. Okay. And
Thank you, sir. That's very kind, and I'm grateful. That's very kind, and I'm grateful.
My question has to do with teledentistry program. Last year's budget had a $737,000 hub and spoke dental pilot program for West Tennessee, and it was not funded due to COVID. And this year budget, you requested $936,000 for 8 positions for a teledentistry pilot program. Again, that was not funded. Can you tell me what was the difference between the two programs, if there was any difference?
Thank you for that question. Teledentistry is something that's high on our priority list. It is, though, if you want to think about it, one of those nice to have, not necessarily have to have. And so the coming year will be a rebuilding year for us. And so we are actually already implemented some of that in our Upper Cumberland region, and we'll continue that. And then as funding becomes available, we may add on to that. But it's going to take a while for us to recover from this. And so you'll probably see that coming back to you.
Madam Speaker, or Chairman, how does a teledentistry program for all of us in here, how does that work?
That's a great question. I get that question a lot. It's actually the same thing through telehealth, as a lot of people are familiar with telehealth now, which is basically a video visit. This is essentially the same thing, except the instruments that go in your mouth have a little camera on the end. Really not, maybe it's an unpalatable example, but it's really not different than a colonoscope. When you have a colonoscopy, it's a little tube with a camera on the end where you can look on the inside. Same thing with the dental instruments. It's actually called mouthwatch. And so the hygienist and other lower level practitioners below the dentist can do this out in the field, transmit the images back to the dentist in the hub. And so it helps stretch our dentist out because we have such a huge dental shortage.
Great. Now, if y'all have gotten, or if y'all had received the $936,000 requested, how many people would have been served under that funding level?
Dr. Jones, was it an additional 7,000?
Additional 7,000.
An additional 7,000.
Yeah. Madam Chairman, that completes my, thank you.
Thank you, Madam Chair. And Commissioner Piercy, I also want to add my thanks for the work you've done. We had an issue with some vaccines in Rutherford County not too long ago, and that same morning you had all the representatives for Rutherford County and both senators on the telephone keeping us informed, and I really appreciate your efforts. Your
you, sir.
proposed budget includes a couple of proposed reductions, and one of them is $3.4 million in federal revenue offsets. But I think that federal money a lot of the federal money has typically been one-time money, but the proposed reductions are recurring. Is there some source of new federal funding that would support those reductions?
Valerie, do you want to take that one?
No, sir, it's not any additional federal funding. What we've done is try to be more efficient with the amount of federal money that's coming in. And so we went and did an analysis, and we're making sure that the federal money is spent before the state, and we saw this as an efficiency.
Okay, thank you. And one more question. I had heard at one time that your proposed budget reductions included eliminating a hemophilia program and a renal program to save a little over $1 million. Are those programs still slated to be eliminated? And if so, why?
That was dropped from our elimination list.
Okay, no more. Okay, thank you.
Next on the list, Representative Shaw.
Thank you, Madam Chair, and amen to all that's been said about you, Commissioner. Is there any studies being done? I know there are a lot of people who are a little reluctant about taking the vaccine. By the way, let me say I've had both. It's really cool. I mean, hey, really the coolest vaccines I've ever taken.
You've always been
So
cool, Representative Shaw.
I would say and everybody ought to get them for sure. But is there any studies being done that you know of by health officials anywhere as to what kind of conditions might react negatively to the vaccines? Because maybe this will help some people who don't think they should take it.
Yes, sir. That's a great question. There's actually a national database that collects that information that everybody can access. It's called VAERS. It's a long acronym, but it's about vaccine adverse events. And so anything from ranging from mild soreness, which you probably had, that's pretty common, all the way up to severe allergic reactions, and all of the factors that might put one at risk. For example, an interesting phenomenon that has been noticed, it's not a medical condition, but some people receiving vaccine that have filler, cosmetic filler in their face, see that it reacts. And so that's an unusual one. There's another one with some different food allergies that have some cross-reactivity. So all of that's being collected, and then once it's sort of substantive enough to be a trend, then that will be published.
I think that would be good because there are so many people. I know one particular case where a lady got a vaccine, but actually she just was afraid of taking shots and she fainted. But she put it off on the vaccine when actually she just fainted from taking the injections.
Yes, sir. That
And I mean,
happens.
and when those kind of things get out in the small communities, everybody says, oh, wait a minute, that thing will knock you out. But I do want to thank you for what you're doing in West Tennessee. And I will tell you that our folk in Hardeman County has been superb in doing their jobs and keeping the vaccines up for us. And I appreciate it. Thank you.
Thank you for sharing
Madam
that.
Chair.
Leader Camper.
Thank you, Madam Chair. Thank you, Commissioner, for being here, and I appreciate the communication and you've always had with me and responding very timely whenever I've asked you a question or for research or anything like that. My question, and you told me this before, but I just would like to get it on the record. With COVID-19, we closed a lot of venues. We had to close restaurants, and we did a lot. And so now we're reopening, and we still have some restrictions in place. But what are the restrictions around stadiums, football games, et cetera, like that? And has there been any official announcement about that?
Thank you for the question. We have no statewide restrictions on any types of gatherings or venues. Now, some of the local metros do, and so they have jurisdiction over that. But from a state perspective, there are no restrictions there. In fact, outdoor venues are likely very, very safe. There's hardly any at all documented transmission in outdoor venues.
Okay, thank you. Thank you, Madam Chair.
Representative Freeman.
Thank you, Madam Chair. Quick question on the uptake that you were talking about statewide. Here locally, we had a bunch of Metro teachers that were traveling all across the state to get shots. And anecdotally, I hear the same thing repeated, that, such and such has an appointment in, McMinnville or wherever it may be. How nimble are you in the distribution of the shots? Are we limited by state plan, by federal mandate on the counties? And I get a lot of questions on, why do I have to drive to such and such to get a shot why couldn't I just do it here? So.
Sure. It's a good question. And I hope those days are almost over because our supply is increasing and the big rush at the beginning is starting to loosen up. Actually, it's probably, to answer your question, it's probably a different reason, and that is the vaccine storage and handling requirements. This is not something you just throw in a Yeti and drive across, county lines. It requires significant storage and handling. It has to monitor the temperature on the way. The place where it's going has to have the proper setup for whatever vaccine you're taking there. But we do have a process for that. Right now, we've been focusing, you've heard me speak repeatedly about equity and allocating on a population-based method to each of these counties. We want counties to have an appropriate amount for their citizenry. But what we're not seeing is when we see the poor uptake in some of these rural counties, we don't want it to sit there. We want it to go somewhere where it's going to be used. So very soon, we will have to ramp up our efforts to reallocate. It's a little too early to do that right now because not everybody has had the opportunity to get the vaccine in each of these counties. But we're going to have to start doing that pretty soon. At this point, what you were describing is what we call vaccine tourism. And I don't want anybody to have to cross county lines, but if they live close to a county with low uptake, there's oftentimes same day availability in those appointments. And if they're willing to drive 20 or 30 minutes, they're welcome to go over there and get it.
Thank you.
Representative Miller.
Thank you, Madam Chair Lady. Commissioner, thank you all. Over 1.5 million vaccinations statewide has been reported so far. Is that inclusive of first and second dose, or?
Yes, sir. So it's actually higher than that now. Since these slides, it's about 1.94 or 1.9. I think that's close. And that is total vaccinations given. So that is also reflective of about 1.265 million Tennesseans. So some of those have had one dose, some of them have had two doses. And now with the Johnson & Johnson product, that is a one-dose series. And so we've had a handful of folks get that. We've only had about 50,000 doses in the state total. And so we'll get some more of those at the end of the month.
Okay.
Representative Miller.
Since we're vaccinating now, are we seeing a decrease or an increase in testing?
We have seen, that's a great question. We have seen some decrease in testing, but it's holding relatively steady. Usually between 16 and 20,000 a day is a good average. Compare that to a few weeks ago, it was about 25,000 a day. But we are still seeing more robust testing than I expected, actually.
Madam Chair.
Representative Miller.
I've had my second dose. So my question is, should I possibly take another test? And there's a reason why I asked that question. I happened to be walking in the hall today, and I heard rumor or truth that a couple of members were tested positive, and currently they are quarantined. And I'm assuming I've been in contact with them. There's no question about that. So how should I react to that?
So I have good news for you. The CDC came out with guidance, I think it was Monday of last week, for fully vaccinated people. So the definition of fully vaccinated people is 2 weeks after your final shot. And so those people are completely exempt from testing or quarantine if they come into close contact, unless you have symptoms. And then if you have symptoms, you should talk to your doctor about that. But you don't even have to be tested or quarantined.
Thank you, Madam Chair. Thank you, Commissioner.
You're welcome.
Representative Lamar.
Thank you, Chair Lady. I'm gonna have to be a little difficult and say I'm bringing light to the folks who don't trust the vaccine. I don't plan on taking it for a while, if take it at all. Just because of historical distrust of vaccinations and what they've done to Black communities and historical experimentations and a lack of research. But I do want to know, have you seen many women who are pregnant take the vaccine? If so, what's the impact so far? Have any of them taken a vaccine and had their children? How are their children doing? And then also we know vaccines have a correlation, not a causation, but correlation with autism. Have we done any research around, will this vaccine correlate with children getting autism?
So thank you for those questions. Let me take the latter one first. This vaccine is not approved below age 16 right now, and it's not expected anytime in the near future to be below 12. We do expect it to go down to age 12. So that's well before, or excuse me, well after the diagnosis of autism, so shouldn't be any concern there. Related to pregnant women, we actually, it's been newsworthy, so maybe we're one of the few states that have done it, have added pregnant women to our 1C, high-risk medical conditions category. Even though the vaccine is not technically approved for pregnant women, it is considered safe. The American College of Obstetrics and Gynecology actually recommend it. And there have been, I believe the latest number is over 20,000 people in the clinical trials who became pregnant or got it while they were pregnant and did just fine. So it is a risk-benefit ratio. We do have to weigh that. But we know that women who are pregnant and get infected, they have a higher risk of morbidity and mortality, hospitalization and death, as well as complications of their unborn or newborn child. So it's a good idea, but it is a personal choice.
Thank you, Chair Lady. You also expressed that the intake is lower in West Tennessee than all the other grand divisions. Can you explain why in West Tennessee?
It's likely because that's where our minority populations are centered in rural West Tennessee. And then just in rural counties statewide, we're seeing it pretty low uptake.
Representative Lamar.
Thank you. And my last question is, you say you're laying off 100 jobs to bring $5 million back to the budget. Could you talk about what are those jobs? I'm sorry if you said it and I missed it, but what are some of those jobs and what are the primary locations of those jobs?
Those are all long-term vacancies, so that is no personnel reduction.
Representative Sparks.
Thank you, Dr. Pierce. Appreciate the good work that you and your staff have been doing and all those other frontline workers. Appreciate colleague from Memphis and her candor. I wanted to ask about flu rates, kind of what happened to the flu.
Well, the flu, we didn't have a flu season this year. And that's a good thing because in all seriousness, it would have been devastating for our hospitals. We did a lot of modeling of what hospital occupancy from flu-related illness is in a mild, moderate, and severe season. And when our hospitals were so strained back in November, December, January, some of them would have been in complete crisis standard mode if they had flu cases on top of that. It's really good that we didn't. There was a good uptake of flu shot this year, but as unpopular as they are, the mask probably cut down on almost all of the flu.
Okay.
Those same techniques that we use to prevent the spread of COVID also prevented the spread of flu.
What about mental health? It seems like on this study, United Health Foundation report, we ranked 47th. Talk about the mental health aspect during this pandemic and what you're seeing.
Yeah, I think we're going to be dealing with the mental health fallout of the pandemic for years. And, if you just think about even the healthiest and most resilient individuals, we've been stressed and we've had grief and anxiety and lots of disruption in our lives. And then when you have someone who doesn't have as much resilience, who doesn't have stability in their homes and lives, and they have additional stressors, poverty, unemployment, we've certainly seen a rise in substance use. We've seen a rise in overdose. And then we've also known for a long time that we have some access issues with access to care for a lot of mental health patients, behavioral health patients. And so that's probably going to get worse too, unfortunately.
Dr. Piercy, I don't have any other questions on my list unless, and I see no hands. Want to thank you. I spoke too quickly. Representative Miller,
Thank
we
you.
were so close.
Thank you, Madam Chair. Just a quick question, Commissioner. In reference to Shelby County, there are two ways that individual can to get an appointment, either online or there's a telephone number. In Shelby County, is Shelby County operating both online as well as the telephone system?
That's correct.
Okay.
Yes, and that is available statewide because we recognize there are people that have technology barriers, either access to technology or the ability to use it. So we always have a phone number for those people who can't or don't want to use technology.
Okay. Thank you. Thank you, Madam Chair.
Thanks, sir.
Well, thank you again, Dr. Piercy. And you mentioned long-term, problems that we probably will be seeing in mental health. And, from what I'm reading and things I've been told, there's some long-term just physical health problems that for people who have had COVID, some have long-term recoveries and some, are continuing for months and months to deal with issues. So while I hope the height of the pandemic is behind us, it's certainly COVID-19 is not something that we're going to be putting in our rearview mirror totally for quite some time. But I want to thank you again. And we spent all this time on COVID because that's top of mind, but we do recognize that your department does a number of other things across the state. And we thank you for taking care of the health of Tennesseans. And I want to take this opportunity for a shout out. Hamilton County, Becky Barnes is our director there. And I just think they have done an amazing job with, in very trying circumstances, particularly initially when there was the first dosage and it was advertised and they were absolutely overwhelmed with people who wanted it, and managing through that process. And they have set up the logistics are great. People, go, it happens on time. And it's been, after a few rough weeks, and that was totally because of the unknown quantity of supply and no ability to control who showed up when. So I just want to give them a shout out, and I'm sure that other members here feel the same way about it, their health departments across the state. But thank you again for all that you do, and we thank you for being here with us today.
Thank you, Madam Chair Lady. Thank you, committee members.
Members, we are back in session. Are there any other items? Any unfinished business? Seeing none, we are adjourned.